All right, well, just as the weather starts to cool off and we switch to indoor activities, some common sicknesses are starting to reappear. In today's Family First, I'm looking at some tips on how to navigate respiratory virus season.
We do see a few more respiratory viruses at this time of year.
Parents, hang on. We're entering respiratory virus season.
There are the common cold viruses, which can include rhinovirus, adenovirus, basically a whole slew of viruses. But the ones that we tend to think about are COVID, flu, and RSV.
Dr. Naazneen Iqbal, a pediatrician at UPMC Hummelstown, says that's because those three usually cause the most severe illness. So what can you do to keep your kids safe and healthy?
One of the best ways to protect our kids is to get them vaccinated. We have the new seasonal flu and the new COVID vaccine for this season have just been rolled out over the past few weeks. And so that's one of the best mainstays that we can do.
And don't be afraid to skip those play dates and keep the kids home from school if warranted.
If your child is sick, just keep them at home.
While they're home, healthcare professionals say to make sure they're receiving lots of rest and fluids. Use ibuprofen and acetaminophen to treat fevers if they're old enough and seem uncomfortable. And try nasal saline sprays and humidifiers to help with congestion and coughs. Still, some symptoms warrant a trip to the doctor, including high fever and trouble breathing.
Breathing fast, wheezing, sucking in their muscles every time they take a breath, or their nose is flaring every time they're taking a breath. Those are all symptoms of increased work of breathing, and this is not something that you can manage at home.
Unless CDC guidelines say otherwise, Dr. Iqbal says once your child is symptom-free for 24 hours without the help of medication, they're usually good to go back to school. Now, if symptoms don't seem to be getting better after 1 to 2 weeks, it's recommended that you reach out to your healthcare provider. And remember that these are just tips. You should always contact a healthcare professional for any questions.